Welcome into the Franklin County NC podcast. I'm James Hicks, and this is a podcast about Franklin County, North Carolina. On our broadcast, we hope you'll learn a few things that you didn't already know about Franklin County, North Carolina, plus some helpful tips for you in your daily lives. Today, I am joined by Virginia Campbell and Cyndi Wright, who are community paramedics in the Emergency Medical Services Department, and we're going to learn a little bit more about what the community paramedic program is. So welcome on to the podcast. How are y'all doing?
I'm doing good. How are you?
I'm doing well, thank you.
So let me ask this. How long have you worked for Franklin County?
So I have worked for Franklin County a total of 9 years, I believe.
Okay.
And I have worked with Franklin County for a total of 10 plus years.
Okay. And all of that time spent in EMS, I'm assuming?
Yes.
Okay.
Yes, sir.
All right. And then I know you've been paramedics for a long time. How long have you been paramedic overall?
I've had my paramedic for 5 years.
Okay.
And I have had my paramedic going on, this will be my 11th year.
Okay. So you've done a lot of different things probably in EMS, but why did you want to become a paramedic?
For me, it was being able to help people. I saw a need there and saw that I could hopefully help people in some way, and I just wanted to be able to be a part of that.
Yes, I would definitely agree with that. It's definitely helping people and helping the families from the people that we're helping, being able to just be there and help them.
You know, and thinking about this, and before we get into what you do, I know that it's one of the things across the country. There's a lot of places that are really struggling in the EMS world. It's not just here. It's not just in North Carolina. It's across the board. Everywhere I've seen struggles with getting people. And I don't know if that's people moving around, or if maybe people just aren't going into that line of work. But if someone was thinking about, going and becoming a paramedic or an EMT, what advice would you give to them to kind of encourage them along?
For me, I would say that it is a very rewarding job. It has its pros and its cons, but the pros definitely add up for me because you're helping families, you are being there when somebody needs you to be there, you're saving lives, you're affecting people and helping people in ways that other people cannot.
Yeah, definitely being honest with them, telling them what experiences you may see in the job, some of our personal experiences, and just making sure that's right for them, but yet encouraging them. It's very rewarding. It's very rewarding to see those outcomes, to be able to help people.
Okay, so the community paramedic program, how long have we had this program?
We have had this program about 6 years, 5 or 6 years.
Okay. Is this modeled after some other programs, or is this something that kind of grew up here? It's specific, or is there some similar type programs other places?
It was definitely some neighboring counties that had it, and when Heather Lewis first started it, she was able to speak with those counties, visit with those counties, learn from them, and basically they were very helpful in helping her get this program started for us.
Okay. 5 or 6 years or so. It's been going along pretty steady, I guess.
Yes.
So explain, what is the community paramedic program?
And so the community paramedic program allows us to bridge the gaps in the community. We saw a long time ago that there was just that missing link out in the community, that people didn't know the resources, didn't know how to get them, didn't know how to use them properly. So we're able to bridge that gap. We're able to give them those resources and help them with that.
Okay. And so what are some of the what a day in the life essentially of being a community paramedic? So what, on a typical day, if there is a typical day, what do you do? What do you do to do this?
Well, so for instance, like today, I have a patient she's an elderly patient. She's a COPD patient, and she lives with her husband. Her husband has dementia. So she gets confused and she can't handle things by herself. So she called me this morning and she was worried about her oxygen. She needed to have it switched out to where she doesn't have to pull it and risk tripping over it. She needs a carry bag. So in order to get that carry bag for her, I first had to calm her down and ensure her that we would get it straight. And then after talking to her, I had to call the medical supply company. I had to talk to them. I talked to the medical supply company and found out what we needed to do. And then I had to call her primary care physician, talk to them, have them send what the medical supply company needed to them. And then when I was done with that, I had to call the patient back and explain everything to the patient to let her know that this is what's going to happen, and then set up another home visit for her. And then when I go out to see her next week, I'll write all this down for her so she can look at it and understand it. So like Virginia said, we're bridging the gaps between the patients, the medical supply company, the PCP. So we're not just going in the homes. We're doing things in the office as well as on the phone with the medical supply company. We're on the phone with the doctor's offices. We're trying to get these patients what they need. And if they didn't have any family or anybody, if they didn't have us, then they'd be lost.
So it's sort of fixing a lot of problems that can be really sorted out, and you could find ways of sorting it out to keep people from missing out on something really important or going somewhere else where maybe it's not as best suited for them.
Correct.
Correct. Because if my patient if she had to risk pulling the oxygen, then you're going to risk her falling. So that can lead to a number of other things. So hopefully we prevented that fall risk, helped her feel more comfortable, and can keep her home as long as she wants to and needs to be at home.
It sounds to me this is helping people obviously stay away from calling EMS or driving to their doctor's office, hospital, whatever, to say I'm having this issue. It's kind of fixing that.
It's bridging that gap.
Bridging the gap. There you go.
Yes.
Yeah.
Virginia says it best when she says bridging those gaps.
Yeah. Yeah. That's it's a very good thing, even with the state of healthcare right now, with a lot of hospitals struggling also with their own staffing levels and doing all that kind of thing. Having people out there sort of mitigating the problems before they even get or doing that. So how many people benefit from the community paramedic program in Franklin County? I don't know what that looks like.
The last time we looked at our active list, we had about 75 that were active patients that we're currently seeing right now. Okay. Referral-wise, it varies. Sometimes we're getting just 3 or 4 referrals a day, but sometimes we might get 10 or 12.
Okay. You get referrals from where?
So they come from multiple resources. We'll get them from our paramedics in the field. Mm-hmm. We're getting them from the hospitals. We're getting them from the home health agencies. We're getting them from the local doctor's offices. The senior center does referrals to us. We have our pamphlets at multiple places around town that they're just able to pick up, and sometimes they call us from those.
Okay.
Yeah.
And we also get them from Mariah Parent Behavioral Health for your mental health patients as well.
Certain amount. I'm assuming some people are probably more like one and done, and some people are regulars and stuff like that. How many, I don't know if you know the numbers off the top of your head, but how many situations, visits do you guys see a month, or however you sort of know to say those numbers?
I think that varies person to person and situation to situation, because like you said, one person may be a one and done. We may not even have to visit them. We may talk to them and be able to fix their problem over the phone, to make a communication, to bridge the gap with the communication between the patient, the doctor, whatever problems that they're having. And sometimes you have to make several home visits. Some people, for myself, I know we have, like Virginia said, our regulars that if we're not checking on them, then nobody else is checking on them. And then we have our people that are on Meals on Wheels who we see consistently every 2 weeks. We deliver their meals and we kind of like do our home visits then. So it's really kind of hard to say if it's a one and done, or it may be 2 or 3 visits and everything's good, you got everything set up, or it may be like you're trying to get this person straight on hospice and you're there, you're making sure everything's there, and then hospice comes in and takes over, and then your job is done. Okay. So it's just really hard to determine that.
I didn't know if you had a generic, I guess, total contacts that you would make. It could be the same person multiple times in that number, but just a generic, how many visits or contacts
Like
month?
total
Yeah.
for a week?
Week or month or whatever, yeah.
I think the last time they pulled our numbers was quarterly, and I was trying to pull it up, but I think it was like 453, and that was home visits and telehealth visits combined.
Okay.
I can get you an exact number, but I don't have it on me right now.
That's good. That kind of puts that in perspective.
Yeah.
Since you don't, it gets probably a little bit farther into the weeds to figure out. Well, we got some people we see regularly, some people we see once, but the total number of what's the number, your work total essentially.
Right. Well, you have the referrals that you get every week or monthly even, and they're estimated. Like Virginia said, some days we can get 3 or 4, some days we can get 10 or 12, but we take those referrals on top of what we already have. Mm-hmm. So, and we have regulars that we're seeing once a week I think for the most part, we try to see one patient for 30 to 45 days once a week to make sure they have what they need and we have completed everything with them. So you take your regulars on top of your referrals.
Yep. And depending on the condition, some people may need a little bit more care than others, but.
So I found it is, we did 368 CP patient contacts from August 1st to November 1st.
Okay. So that keeps you really busy out there.
Yes, sir.
Yes, it does.
Let me get a little bit farther into what services you provide, so to get an idea of, obviously, we're not going to call you out to amputate a leg or something like that, obviously, but what are the general services that you would provide in the community paramedic program?
So we're going to do well-being checks. We're going to do home safety assessments. We're going to do fall risks to try to keep you from preventing falling. We're going to do the chronic disease education. We're going to do just education to whatever you have going on. Do you need education on what your disease is? Do you need education on your medication? We're going to make sure that you have education on what to eat, how to eat it. We're also going to connect you with those resources. If you need home health, if you need hospice, we're going to get you those resources of how to have those.
Okay.
Yes, and I would like to say, we're just making sure that these people are taking their medications. They're able to get their medications. They're able to get them from the pharmacy to get them home. They're able to keep their appointments. If they can't keep their appointments, then we're trying to get them hooked up with public transportation, family. Somehow we're trying to make sure they get those appointments. They're aware of those appointments. They're keeping them. They're taking the medications, things like that, so they stay on track.
We try to make sure that their insurance, if they need assistance with getting Medicaid, maybe they don't already have it, but they do qualify for it, make sure we get them help with that. And when it comes up time for the Medicare every year, we make sure they have those appointments for that, and they're evaluating, what plan is best for them, and they have those appointments set up for that too.
Okay.
And meals are a big thing. We help them with Meals on Wheels too, because sometimes they don't have what they need in the home to eat. Mm-hmm. So we make sure that they're aware of that resource through our senior center, and we're able to connect them with that.
Yes, and we actually deliver the meals to the people who are not in city limits to where they can get meals every day. So we do take them their meals twice a month and deliver them for them. And like I said, if it wasn't from that, some of these people wouldn't even see anybody. Mm-hmm. So
what it sounds like to me is kind of you guys are the Swiss Army knives of the medical field. You kind of
we try.
You're filling these gaps and keeping some things. I know that a lot of times I've heard, because this is the first time I've ever seen this kind of program, but I have always heard of people who they didn't have any family nearby, or they didn't have, a car, or they couldn't drive, and they're shut in. And
we take so much for granted, because there is a lot of that is out there that we just don't know about.
Yep. And so this is a program that allows them to more or less be checked in on, mm-hmm. Make sure they're staying healthy, doing those types of things. Is there any memorable other stories that maybe could shine a light on kind of what you do? Maybe more like a case study or something.
So I had a lady, chronic illness, that had took a pretty serious decline in her health. She and her caregiver were here and have lived here for a good 10 or 12 years in the county. They knew their neighbors, but they had no family. All of their family was across the country, so no one close that they could lean on. And they were doing the best they could. She did take her medicine like she was supposed to. She took good care of her health, but unfortunately it was declining. And they were at a loss as to what to do. And I started them out with home health. And we followed through with that for a few months, and it was very helpful to them. I still continued to visit, made sure that she was doing her exercises in between, that we were changing the diet like we needed to. Her health still declined. We talked about the possibility of hospice, and they were completely against it. So we switched up to palliative care. They agreed to that. Palliative care was very short-lived, and we did have to switch to hospice. They asked me to stay on with them because I had built that trust with them and followed through. And so I did. I continued to visit, continued to see, and I was the eyes and the ears for hospice while we were there. And there were changes that I saw that hospice had not seen, and that the nurse wasn't there, that the patient and her caregiver were not confident enough to speak to hospice about, but they would tell me. So I was that liaison, and I was able to be that mediator for them. She unfortunately passed away. And when she did, I continued to follow up with the caregiver for a few months just to make sure she was okay. They didn't have family here. I wanted to make sure that she had all the resources she needed. She was taken care of too. And that was very helpful to them, and many thanks have been given for that. So that was very memorable for me.
And she still appreciates it to this day. She still calls Virginia and thanks her, and she's very appreciative of it.
Thinking about that, and when you were talking about that story, I remembered when my grandmother, my father's mother, she got diagnosed with leukemia, and just out of the blue, she had pneumonia, went to the hospital. They said, "Oh, you have leukemia and you have 2 weeks to live." And so took her home, hospice. She didn't want to do anything. And she actually lived for about 4 more months, actually. We kept getting that 2 week kind of thing. And but the hospice nurses, I mean, as great as they are, they're only there a certain amount of time. So it's whoever's,
That's right.
actually doing more, being there more to know what's going on, which my grandma, she refused to have hospital bed brought in, and we had to sneak it in. Me and my cousin had to disassemble the bed and then bring the thing in, and we tricked her because she was going from bedroom to bedroom. And then they put that in there. She was so mad. She was so mad about it. But that was a time of interesting. She had some good hospice nurses. She didn't necessarily like the hospice nurses, but we liked them,
right?
Because she was still, But yeah, it's good to know that there's these services out there. So. If this might be for someone out there who needs a service, or more likely someone who may know of someone who might take advantage. I'm assuming y'all are not filled up yet.
No,
there's always a capacity for more.
Absolutely, you can always reach out to us. You can call our county cell phones, or you can email us at the community paramedics at franklincountync.us.
Mm-hmm. Or I guess you could also call the main EMS number at 919-496-5005 to get, schedule, talk to someone.
Yes.
Yep.
Schedule.
Just ask for the community paramedics.
Yeah. And they will get that to get you hooked up with those services. Okay.
So let's talk about some of the people that we work with in the county. So we work with the senior center.
Mm-hmm.
We work with home help. We work with the hospice agencies. We work with our hospitals, our doctor's offices. We work with APS, CPS, DSS. We try to get all of those in. And I know there's a bunch that I'm not listing. Safe Space, we work with them. Veterans Affairs, we work with them.
At home counseling, care and share. It's a lot of people that we work with in the county that help make our job possible.
Absolutely.
That help make it easy and help us to assist the people in the county.
Yes.
We also didn't mention anything about the overdoses in the county that we work with. Mm-hmm. We definitely try to get involved with our overdoses. We do have a program to where if we go out to an overdose, then we leave a Narcan kit for the families, for the people that have overdosed. And we try to talk to them and get them to get treatment, see what we can do to help them. Some people are just not ready. Some people are receptive to it. But we try.
And Visions and VIA are both very helpful with that and being able to work with them.
And I know y'all just did because I kind of not forget about this, drive with county employees to collect some things for homeless people in Franklin County.
Yes, we also have started recently, just a couple of months ago, Virginia and I started making homeless care packages. We call them care packages for the displaced. And we have one on each county truck, and we have them on our QRVs as well. We actually have blankets for them. We have, in the care packages, we have food, gloves, different items, soap, toothpaste, just things like that. They can help them. And inside the care packages, there's also a list of resources that the county has, the Care and Share, all the food banks, things like that. And we have our information in there so they can reach out to us. So hopefully we can help with that.
Yep, sounds like a great kit to kind of help someone out in that situation. At least we got through to the bulk of what the community paramedic program is and what you guys do and how anybody else could reach out. I will say I did update the EMS page on the website and put the brochure, the current brochure is listed on there. So this information is there. So anybody going to franklincountync.gov can go over to the EMS, Emergency Medical Services page, and then click the community paramedic link on the side and get some more information.
So if I could just add something to that, with all that information online, we also have what you call a special needs registry that is under the emergency management. With that special needs registry, this is for people who are on oxygen, who are bedridden, who would need
transportation assistance, possibly wheelchair bound.
Yes, or oxygen, like if your lights went out, if there was a storm or snowstorm or something, and if you or your family member would be impacted by that, if you would contact us and make sure that they're either already on the special needs registry or we can add them to the special needs registry. Virginia or myself could do that. That would be very helpful in a bad situation.
Yeah, with some of that stuff, I know you have things that are very, very important medical equipment that needs power constantly. So, if it's going to be out for a couple of days, you definitely need to have those folks on a registry to know to get them some resources there. Well, that's I've learned a lot about the community paramedic. I knew the surface level stuff, but I know a little bit more today, and hopefully everyone else has now. That's all the time we have left for today. Tune in for more informative shows about what is happening at Franklin County NC. Like or subscribe to the Franklin County podcast on your favorite podcast platform. Share a comment or a review. To find out more information about Franklin County NC, go to our website at www.franklincountync.gov. Sign up for our email newsletter while you are there. For all of us here in Franklin County, I'm James Hicks, and we'll talk to you soon.